You know, patients think, oh, my primary care doctor talked to my specialist and they know exactly what I told my pharmacist last week. And they know what the dietitian told me to do with my diet 3 months ago. And they know what the physical therapist is doing. And sadly, that's not the case. So, how do we fix that? I was introduced to a group who wants to think on a much, much bigger scale. And they are from the public health world and have a new science that's an ecosystem design collaboration science that is based on the fact that we are all intrinsically valuable and everybody has something important to bring to the solution. And so they are forming collaborative groups of this massive network of everyone who wants to see healthcare improve. So we're talking government and payers and medicine, nursing, pharmacy, business, legal, like everybody that wants to see healthcare improve, to collaborate and solve tremendous worldwide problems. And they've invited Medipreneurs to be a partner, to just be a conduit to bring the health entrepreneur world into this solution.
I am extremely proud to introduce to people that polish your life. If you're part of our network, now you're part of Medipreneurs network, and now you're part of Intrinsica network as well. And if you're a provider, you feel like you're alone, we can refer you to the right people and find these resources that will give you shortcuts, save you time, improve clinical outcomes as well.
Specifically address this medication optimization. And I would be first one to say medications may not be the answer. And so looking for integrative approaches that don't involve medicine is a big part of the solution to this.
You're not alone. It seems like you're alone. You're not. Welcome to Polish Your Life. We are here because there are many people who go from doctor to doctor. They follow recommendations and sometimes they still don't feel better. We believe this is not right and we are here to support. And if you've been following our content, you know that we've been searching for the best healthcare providers, the best integrative medicine providers, to bring them to you, to give you a chance for the best clinical outcomes. And sometimes we have providers contacting us individually, joining our group on Facebook, and we appreciate that. And sometimes we have bigger announcements like today that we actually have a group of integrative healthcare providers collaborating with Polish Your Life, and we are very, very proud to introduce to you our very special guest that is here with me. We are talking about Dr. Michelle Fritsch, who is the founder of Medipreneurs. So you're going to learn a lot, and if you're a healthcare provider yourself, this is the person that you definitely need to connect with, find out about the upcoming events, and collaborate with, because she has an amazing network, many resources for you, and I think you're going to be blown away with the amount of value that will come after the connection. So Michelle, welcome to Polish Your Life.
Thank you, Mike. So honored to be here.
Thank you. Thank you. Very good. Awesome. So let's talk about, maybe let's start at the beginning and tell people who are watching maybe for the first time, maybe they don't know a lot about integrative medicine as a concept and they don't know anything about Medipreneurs. Let's start there. What is Medipreneurs?
So Medipreneurs is an organization to support people in healthcare who have left traditional practice and needed to form their own business. And often that is because they didn't get to provide the kind of patient care they wanted to in the traditional practice. And they saw an opportunity to do things better. And they sought on their own a way to develop a model that was different, but that can be incredibly lonely. So it was three of us, Dr. Anna Garrett and Sue Paul and myself, who came together and realized that as entrepreneurs, we could really help each other because we kept encountering different barriers along the way of developing what we were developing. But when one of us reached a barrier, someone else in the group had probably already figured out how to navigate that. And so if the three of us could help each other so much, imagine if we invited all of the health entrepreneurs to have this opportunity to be together, network with one another, and problem solve together. And it's been a wonderful journey.
This is so much needed. And we can see it also here at Polish Your Life that sometimes that simple equation of, 1 + 1 does not equal 2. It's three,
Right.
4, 5, and more, and learning from each other's mistakes, and also having that level of support, especially when there's sometimes, especially in health, there are time sensitive matters, right? The patient may need
Yes.
support today. They don't have 17 extra months for our healthcare provider to figure out something. But if the mistakes over the last decade can be consolidated, and then they can come in a form of a, advice or support from a phone call from another provider, then the patient wins, the provider saves time. And I think that's quite amazing. So let's talk about the bigger picture. That right now I know that there is this big announcement that you want to share with people, and I want for people to understand the importance of that announcement. So let's talk about Medipreneurs and also your announcement, what's actually about to happen or is actually happening right now, and how it can affect people.
So let me start with a little bit of history of Medipreneurs. The first time we gathered was April of 2018, and we did not know what to expect, but we had 83 people came, and our primary sponsor at that gathering said on the evening before the thing even actually started, it was the evening when everyone just kind of gathered at the hotel. He said he had never seen such energy at a professional meeting in his entire career. And this man was in his 60s. So it brings together that excitement of I'm not alone on this journey. And wow, all these other people are doing very similar things. So there has been an annual meeting, minus COVID. There's been an annual meeting every year, but also we've started a membership. So as people need different levels of support on their journey, we've been able to provide different levels of support. And the group just continues to grow because more and more people are feeling rather burned out in the current traditional healthcare setting and are seeking different ways to practice in a way that honors the years they gave toward their training and the types of patient care that they wanted to provide. So the next of those annual meetings is in August in Cincinnati, August 26 to 28. But along the way, September of last year, I was introduced to a group who wants to think on a much, much bigger scale. And they are from the public health world and have a new science that's an ecosystem design collaboration science that is based on the fact that we are all intrinsically valuable. And everybody has something important to bring to the solution. And so they're forming collaborative groups of this massive network of everyone who wants to see healthcare improve. So we're talking government and payers and medicine, nursing, pharmacy, business, legal, like everybody that wants to see healthcare improve to collaborate and solve tremendous worldwide problems. And they've invited Medipreneurs to be a partner, to just be a conduit to bring the health entrepreneur world into this solution. So there will be researchers, there will be patient advocacy groups, there will be funders and resource partners. But on the action side, that's where we see the entrepreneurs. They can take the best of the research, put their innovative minds to work in an interprofessional, collaborative way to create solutions that have real world meaning. You know, health systems can actually use these solutions and get the outcomes that they want. Wow. That's a lot. Did that make sense?
Wow, that makes perfect sense. And I'll tell you, there's a great moment of hope and knowing that we will be able to get support on a much bigger level. What does it mean to this healthcare entrepreneur? What does it mean to this individual provider to know that there is also the support from another layer? Even we are talking about maybe regulations will change for the better. Maybe the clinical protocols are going to change for the better. The standard of care can change for the better. And this is, to me, just so valuable because we have a lot of healthcare providers who rightfully complain about the system. And they say, the system is broken. This is bad. This is bad. But complaining alone is not going to solve anything. Complaining alone just highlights that there is a problem, and it should be limited because it's also negative energy, and we need to work with the tools we have. And we actually have plenty of amazing tools and technologies, and innovation is going forward. So why don't we take the best of what we do have?
Yes.
And then we combine it with all the potential that we can have, and with this level of support that we can expect from more and more collaborative partners like Intrinsica, now we have hope that the whole environment and the ecosystem is going to start changing. How beautiful is that?
It is beautiful. And two key things that you bring to mind. One is when we leave traditional healthcare and take off as an entrepreneur, it can have a feeling of survival. I'm by myself now. I don't have all of these people. I've got to put food on the table. I've got to find new patients. I've got to, whatever I've got to do to reach the next level. And this allows you to be in a place where you can bring those problems and not feel so alone in tackling them. And perhaps the solution is not you doing it all by yourself, but rather forming an interprofessional group. The other thing you make me think about is, because healthcare is so broken, I picture it as a rope that's gotten very fragmented. And each time one of us breaks off as a solopreneur, it kind of pulls a few strands out of that rope again and makes it more frayed. So let's rebuild the rope in an incredibly collaborative, interwoven way.
Wow.
that acknowledges that we've got to treat the whole person. Health is so much more than diagnosis. We got to get to the biochemistry at the bottom of what is going on, and we've got to address the mental, the emotional, the spiritual, the social, all aspects of health, which is that integrative medicine approach. So if we reestablish healthcare with that in mind, and we're doing it together, it could be so beautiful.
So beautiful. And what I love about this is when you mention so many different aspects of healthcare, it is so true that we have, and we talk about the concept of integrative medicine, integrative healthcare. Mm-hmm. And I think a lot of people right now start embracing it, understanding it, and being more familiar with that. The beautiful part of the practical implementation of this is that it's not just theory. We actually need all these components, like you mentioned, from mental to spiritual to, the chemical, and all these different physical. All these components need to work hand in hand, and there is possibly no way that one provider knows it all. There is no way that one provider has all the answers, and there is not enough time for one provider, even if they're the best with the best heart and the most hardworking, to be able to figure everything out. So having these type of collaborations, it gives me chills. I think it's amazing to know that there are more and more people to do something about it, and having support from bigger organizations like you mentioned. Right now, it gives us hope that there is going to be more energy allocated towards solving these problems. So let's say somebody is watching this right now, and maybe you're watching this and you are a chiropractor. You're watching this, you're an acupuncturist. You're watching this, and maybe you have a concierge medical practice, and you're wondering, what exactly does it mean to you? Let's say I connect with Michelle, and what will happen next? So let's give people an example, if you don't mind, of what can happen right after the connection, just so people watching this can have a practical example and realistic expectations as well.
One thing that comes to mind is I've seen this over and over at Medipreneurs live events, because we know that there's so much more collaboration that can happen when we're actually together. And so at live events, repeatedly, I've seen people say, okay, this is my business model. This is what I'm going to do. This is how I'm going to take better care of my patients. This is what is going to happen. But they're sitting at a round table with a bunch of other innovators who challenge that approach. And they're like, well, did you think about this? rather than doing that yourself, did you think about bringing someone on board to do that aspect? Because you just said that's your weakness. Did you think about, rather than take this approach, if you tweaked it just a little bit, maybe that would be more effective? And so you walk in thinking you've got a really solid plan, and you walk out with a much more robust plan and a group of people who understand what you're doing and are a phone call away to help you step by step. And then my vision for this is that we train in silos. So when you think of the rope analogy, we train as individual pieces of twine. And then we go into practice as individual pieces of twine without a deep understanding of what all of our fellow health professionals even have learned and what they're capable of doing. And I've seen too many times when we get a negative impression, oh, well, pharmacists are just about pushing pills. That's all they're about. We don't want to talk to pharmacists or whatever. And that's not true. It couldn't be further from the truth. So as we get to know each other and overcome, break down those barriers and become that intertwined rope where we're taking the best of what each of us knows how to do, it's amazing how that will be so much more effective for our patients, for the bottom line, the cost of our healthcare system, and improving the overall outcomes.
So powerful. And thank you for bringing that example, because I think a lot of people can relate to that, you're studying alone. Yes, you have a group of peers, but it's you and the books, and then there's the exam. And I don't know if the collaboration is really fully in place right there, right? Then you open your own practice, or maybe you're working as an employee, in a hospital setting or a private practice setting. And sometimes you're really not in the room when some of these things are being discussed, and you're lacking some of the knowledge. Then, like you mentioned, some providers break out, and I think that's a good thing, and say, okay, I'm going to start something on my own. I'm passionate about X, Y, and Z. I have my patient base. I have my dreams to realize, and they start. At the same time, the mistakes they're about to make have already been made by a lot of other providers. So if you are in the room with other people who can guide you, coach you, share their experience, and like you mentioned, you have something in your plan, and maybe you need to reevaluate how that something is presenting in that plan. And people can tell you that not just because they want to talk about it, but they probably have gone through it. And they're saying this to save you time and to help you succeed on that entrepreneur journey. And you can be an entrepreneur in so many different fields, but healthcare is the special one that the impact is on a family that is on the other side. If somebody has a diagnosis and the entrepreneur healthcare provider is successful in solving the problem or putting a big dent in the problem, it's not only that one person, that patient, that gets better, but that affects the whole family if the diagnosis was serious. So it really is amazing. I wanted to ask you, maybe if you could bring to people's attention some of the maybe like 3 most common challenges that healthcare providers have right now if they're on their own, and then they can have some idea that these are the ones that they can have support with.
The one that comes to my mind is the biggest one, is having the patient's full story in front of you before you ever make a decision. I find rarely do we know exactly what all the other members of the healthcare team are doing. And when we leave as entrepreneurs, it's even harder to access all the data that's in their records in other health systems. And so we don't have just the information we need to make sure that we're operating with the latest diagnoses, who's prescribed what the patient is choosing to do on their own, pharmacologic and non-pharmacologic kind of solutions for things. And if you're making decisions without that whole picture, the liability, like you say, healthcare has huge liability anyway, the liability is higher. So one of the problems we've got to resolve is, how do we share information or put it in the hands of the patient in a way that anyone making a decision is truly making that decision with every piece of detail they need to make an accurate decision. And then along those lines, just communication among each other. Patients think, oh, my primary care doctor talked to my specialist and they know exactly what I told my pharmacist last week. And they know what the dietitian told me to do with my diet 3 months ago. And they know what the physical therapist is doing. And sadly, that's not the case. So how do we fix that? How do we make sure that we're talking to each other and we're able to give each other clues and changes and key things that are happening over time? We'll often hear the patient say, well, I was supposed to do my exercises every day, but now my back is really hurting again and I haven't actually done them at all. They may tell one of the providers that and not the others. Or maybe the reason their back is having so much trouble is they were just really struggling with their weight loss, but nobody's really getting to that element of it. How do we help identify, is it emotional eating that is the problem? So if that's the case, are we getting to the bottom of the emotions? Sorry, I'm going off on a tangent, but communication and being able to share what's happening with that person to get to have a more group think solution that's consistent and the patient's hearing that we're all on your team and we're all feeding into your care. That's important. And I will tell you, I've given several presentations lately. And one of the things I encourage people to do at the beginning is get out their eraser and erase all the barriers that are coming to mind. Oh, you can't get paid for that these days. Oh, the healthcare system doesn't support that. Oh, they'll never allow us to all be on the same medical system. I think we've got to erase all the current barriers and reframe this in what could happen in a way that we're demonstrating that the new way is not only better for patient outcomes, but more cost effective.
So powerful. What you said is powerful on so many levels. On one hand, everybody knows that in the ideal case scenario, we have a patient who tells us the whole story. We have enough time on the provider side to listen to the full story, and we have a communication system to be able to collaborate with others so they can know the parts of that story that are relevant to the other provider. Because just like a cardiologist and personal trainer and a dietitian will all work on the patient's heart, they very rarely communicate, and we talk about it in Polish Your Life all the time. So right after people nod and they say, yes, that would be good to have, what you mentioned actually comes to their mind, which is like, yes, but this is not possible. This is not realistic because, and they will give us 17 different reasons why. Right. And why don't we take an eraser and start erasing these reasons as blocks for making something possible? At the same time, what we could do, I think, is right before we erase, we can ask ourselves a question: what exactly can be done to make that block or that objection or that problem smaller? Because yes, I understand we cannot have a possible, unless we have this neural link with, all the future AI and communication directly from brain to brain and all secured, HIPAA compliant, etc. I don't think that it's going to be super easy for us to have this full picture just transferred from one provider to another. At the same time, we can really improve the percentage of that knowledge transfer. We can improve the process by a lot. And sometimes just knowing that there is a mental issue or mental health issue connected to maybe past trauma that is now affecting the physical organ in this way, just simple knowledge of that one small piece of the equation can be instrumental in the final outcome.
Yes.
And I want people who are very skeptical, and I understand that there are some analytical people who will just go blindly with a black and white approach and saying like it's binary, either it's possible or it's not possible. Many people, to what you just said, will say it's impossible because, and will give us some things. What I would like to encourage you listening or watching this to do is to imagine if something ever appears to you black and white, imagine that there is a rainbow in between. And we can actually go through all the colors and not necessarily focus on binary options only, yes or no, possible, not possible, but we can make it more possible. We can make it possible later. We can set ourselves up to make something possible under certain conditions, right? So it's not possible if, but if we are able to fix the if, now it becomes possible. So I'm always very optimistic, and just seeing how healthcare collaboration, even with the story of my wife, is able to get one family so much better. I know
Yes.
that it's not impossible. It takes a lot of work on the provider side. It takes a lot of work on the patient side. It
Mhm.
also takes divine power and the universe, God, and whatever you believe in. It takes that spiritual aspect, and the stars need to align, let's put it this way, but we can help the stars align. So I
Yeah.
think this in this context, I am extremely proud to introduce to people that Polish Your Life, if you're part of our network, now you're part of Medipreneurs network, and now you're part of Intrinsica network as well, and the potential. And we are adding more and more of these groups for you, because if you're a healthcare provider yourself, you may be a patient watching as well. Just know that they're a group like ours, and we can refer you to providers. If you're a provider, you feel like you're alone, we can refer you to the right people and find these resources that will give you shortcuts, save you time, improve clinical outcomes as well. Let's talk about how can people connect with you?
They can learn more at medipreneurs.com. They can come to the launch of Intrinsica and what Medipreneurs will be doing there on June 21st. We can put all of those links in the chat, and they can reach me at info@medipreneurs.com, or I'd be glad to include a phone number and people can reach out to me as they want.
This is awesome. Very, very important. Please connect. Also, keep in mind that there are different events that are going to be happening over time, and some of them may be very important for you. So if you're watching this at the time of the recording or very close to the time of the recording, there is one event coming up, which is a virtual event, right?
Yes,
Let's talk about this one. So this is the 21st of June,
of
2022.
June. So right around the corner. And Intrinsica is this parent company that's striving to solve the world's biggest problems. And the first problem they're addressing is healthcare related. The lack of medication optimization is costing the US $520 something billion a year. So they're approaching that with a study, I guess, called Rapid Alliance that is bringing together researchers from around the country, healthcare entrepreneurs, which is us, funders, resource partners to specifically address this medication optimization. And I would be first one to say medications may not be the answer. And so looking for integrative approaches that don't involve medicine is a big part of the solution to this. So all of that gets launched on June 21st. Like you say, it is virtual. So you can go to either intrinsica.org, it's a nonprofit, intrinsica.org, or rapidalliance.org to learn a lot more about that launch. It begins at 11 a.m. Eastern time on June 21st.
Awesome. And we can put the link in the description or post caption. If you're watching this after the event, the link may be removed, but we may put another link right there so you can connect. And then what about the main event, Medipreneurs event, that is the annual? Right now it's the 5th annual, correct?
It is. We're having a big 5-year birthday celebration.
Happy birthday. Happy early birthday.
Thank you.
And that is, please give people a date one more time.
It's going to be at the University of Cincinnati. And we will gather, like I mentioned, we gathered the first time just in the hotel on August 26th, which is a Friday evening. And then programming will be all day Saturday and Sunday, August 27th and 28th. And we've got, these are workshops. It's not going to be like talking heads talking to you. They're workshops for people that want to further develop their businesses and their clinical ideas. And so there will be things for people that are early in developing their ideas and things that are people whose businesses or practices are very advanced, but helping you take it to the next level. So a wide variety of programming options.
This is awesome. So 21st of June 2022 is the first event. And if you're watching this before the event, this is a virtual event. Please join and be a part of this connection between Medipreneurs and Intrinsica. You're going to learn a lot. And I think you're going to be very excited to know what is actually coming. The second event is going to be the 5th annual Medipreneurs event. This is going to be in Cincinnati. It's August 26th, 27th, right? These
28, 26 to 28.
26, 20, 27, 28. And this is going to be the in-person event with a couple of hundred healthcare providers promoting integrative medicine, giving you a lot of resources. Definitely something you don't want to miss. We'll put a link to that as well. And after that, if you're watching this and maybe it's already 2023, 2024 and beyond, there will always be more events that we're going to be giving to you as a potential for you to attend. So connect directly with Michelle and follow the links in the post here, because it's important. It's important to have that kind of level of support, and also to know that you're not alone. It seems like you're alone. You're not.
Very good point.
Awesome. Fantastic. Anything else you would like to add before we go today?
I appreciate the opportunity to be here. I do believe integrative health is the wave of the future, and I'm so excited that we can collaborate and figure that out together.
Thank you. We will figure this out, and we are on our way there. So thank you so much for watching. Please connect. Ask if you have any questions. You can comment below. If you think that you need a specific type of provider that you would like to connect with, you can comment below and you can say, I'm a chiropractor looking for an acupuncturist in this area. Our network has been growing so much that I'm very happy to say that more likely than not, we'll be able to give you some resources. If it's not immediately, we're gonna also search for you, because we have people who will do it for you just to support. Follow our content online, follow Polish Your Life, Instagram, Facebook, and our YouTube. Subscribe to our YouTube, and that's because, not because we need it, it's because we have amazing healthcare providers and people and collaborating agencies and entrepreneurs and just amazing organizations like Medipreneurs, like you can see here. So have a wonderful day, all the best, and stay healthy, our friends.